What we're about to discuss is a very serious issue in Eswatini, gender-based violence. This is the Rise and Thrive podcast brought to you by the EU delegation to Eswatini. This podcast is dedicated to uplifting voices and breaking down barriers. I'm your host, Rhoda Mokio, and this is Air It Out, a 4-part series initiative aligned with the Global 16 Days of Activism campaign, which aims to address violence against women and children. Join us for the next 4 episodes where we will be shining a light on the theme, Break the Silence, End the Violence. Together, we will confront difficult truths, share powerful voices, and amplify the voices of those working tirelessly to make a difference. In this episode, we have an address from the head of the EU delegation to Eswatini, Mr. Karsten Mecklenburg. His address is followed by an interview with Katrin Lehmann-Kunene, director of Phumelela, formerly known as the Phumelela Project. I'm a survivor, he's a warrior. One day. Please introduce yourself.
Good afternoon. My name is Karsten Mecklenburg. I'm the new head of delegation, ambassador of the European Union here in Eswatini.
Why is being vocal about gender-based violence important for the EU delegation to Eswatini?
Well, for the European Union, advocacy for gender issues, for women's rights, has been a long-standing issue, has a long history inside the European Union. And our engagement in our partner countries like Eswatini has also a long track record in terms of caring for gender equality, looking into issues of enabling, empowering girls and women, and also to address the issue of enabling them to take part, contribute to the society, take their place in the society, which is traditionally, we see it also in our countries, very often limited to managing the households, education, taking care of the kids. But this is not what should limit girls and women. Girls and women have much more potential, and this is what we want to support. It's also something that contributes to the society. And what I see in the country here is sometimes encouraging, but sometimes also raising concerns. And I'm aware, having talked to government ministers, to the Deputy Prime Minister, to other members of the government, having talked to women and girls themselves, to civil society organizations, I see that there is tremendous challenges. And unfortunately, gender-based violence is one of those challenges.
As a male leader working in Eswatini, and witnessing the challenges around gender-based violence, how has the issue impacted you personally, and what insights or reflections have shaped your perceptions on addressing it effectively?
Thank you. Indeed, the male perspective is important for that, and I can only encourage men and boys, both those foreigners like me, but also Emma Swati, to change the perspective on the issue of gender-based violence. I know it's an issue that exists in many countries, and I wasn't surprised that the issue of gender-based violence is also existing in Eswatini. But going out to the countryside, I have visited some of our projects. I have seen and talked to some victims of gender-based violence. And it is something that doesn't leave you without emotions. It is really something that has impressed me, that makes me sad also when talking to those girls that have been suffering from rape, that have been suffering from other forms of gender-based violence. It is something that has been taken up by the government. Again, when I'm talking to the Deputy Prime Minister, when I'm talking to other representatives of the authorities, also to the police, for example, I feel this has really been taken serious. But again, from the perspective of the women, you feel the sympathy. You feel also those women that are engaged to help the victims of gender-based violence. But the real game changer needs to come from the male side. It needs to come from the side of the boys and the men. And we, with our engagement here in Eswatini, try to bring forward this agenda to support those who want to change the situation, to want to help the victims, to want to work on prevention. That is very important, to change the mindset. And again, when I'm saying, talking from the perspective of Europe, I know we also come from a kind of up and down development. It hasn't been always ideal in our countries as well. The situation of women and girls, the situation how men behave towards women and girls hasn't been clear-cut either. And we want to come with that experience and contribute to the improvement of the situation here in the country.
What new strides is the EU and Eswatini doing to address gender-based violence?
Thank you. We have been very active in that thematic area already for quite some time. If I refer to, again, I'm new to this country, so I'm learning myself also, but I want to pick up on what we have been doing in the past. One of our flagship projects has been Hlonipeka, Driving for Dignity, where we have been already supporting those organizations, civil society organizations also who are active in the area of gender rights, gender equality, but also fighting gender-based violence. If we look in the future, the new programming we are working on, where we are defining the priorities for the months and years to come, we will also put an emphasis on the young generation in general, like seeing where is the challenges. Youth empowerment, youth unemployment. So we will do a lot in terms of supporting civil society actors, but also the government for creating jobs, employment opportunities. But in that context also, again, looking at vulnerable groups. And vulnerable groups are, again, women and girls, and also victims of gender-based violence. So to try to put a focus on, when we look at creating employment opportunities, when we look at creating opportunities for professional education, for example, for giving support to creating and launching your own business, so that we don't forget about those vulnerable groups, and then we also keep in mind the gender issue, and that we always have victims of gender-based violence on our agenda in terms of implementing our projects.
Today, our guest is Katrin Lehmann-Kunene, director and co-founder of the Phumelela Project. Welcome, Kat.
Thank you for having me.
Thank you so much for coming. Could you please paint us a picture of what the current state of gender-based violence is in Eswatini?
Yes, so in Eswatini, we currently face a gender-based violence crisis. The cases rise in the country, especially since COVID. And it's 1 in 3 females have experienced some form of sexual abuse by the age of 18. And 48% of women reported to have experienced some form of sexual violence in their lifetime. And if you read the National Surveillance System on Violence report, there has been also a 50% increase in reported GBV cases since 2017. Then you must also consider that some cases are not even reported.
That's quite a steep increase, my goodness. So with such an increase, currently also just high numbers in general of cases, what sort of interventions have you implemented as like the Phumelela Project in Eswatini?
So currently we have 2 projects running, which is the Gagogo project. So in the community of Nyageni, it's in the Manzini region, we're currently building a soup kitchen and a child-friendly counseling room, where obviously counseling will also take part for all community members. Then with the CFLI, Canadian Embassy, we're running an empowerment self-defense program in 3 schools in the Lubombo region. So kids in school will form clubs, and we go through different topics like gender equality, gender-based violence, mental health. And the girls will also get a self-defense course, like a physical self-defense course. And then if you look in the past, we've trained psychological first aid responders in several communities to be there when cases like this happen, and then they can refer. We had a Safe and Serve project funded by FMB Foundation, where mainly in the Manzini region, we trained bartenders, hair stylists and barbers as gatekeepers for GBV. Again, because you go to the hair salons, for example, and you talk. So we try to train those identified people to know how to respond to cases and where to refer to, and basic counseling skills or listening skills, basically. Then we've developed with Antidote Foundation, Cultural Foundation, and Yebo Art Gallery a mental health toolkit, Lighten Your Burden. And then we've been disseminating information on radio, in the newspaper. And then one of our main activities is free counseling. We do it in our office where we have a small counseling room or via the phone as well. And we offer walk and talk sessions, which is a unique form of counseling where we take some of our clients to Milwani, and the counseling session will be facilitated while walking instead of sitting in an enclosed space. Can be quite intimidating for some people.
Yeah, I imagine the looser environment definitely helps facilitate those like difficult conversations. Also, I love how you engage the community in sort of addressing these GBV issues with the barbers, for example, sort of making everyone responsible for the abuse that happens. It's a lovely.
Yeah, because also statistics show that 88% of the perpetrators are actually people the survivor knows. They're not just strangers.
Yeah, absolutely. And in that, in like cases of familial abuse, domestic abuse, there's this sort of culture that we don't talk about it, it's just things that should stay at home. Do you have any suggestions, any tools that people can use to sort of reframe that and reframe that thinking around the shame to encourage more people to come forward?
So what we've also seen with a lot of cases we receive is that the perpetrator is often the breadwinner. So there are power dynamics playing a role as well, for example, power dynamics and shame as well. So obviously it is hard for the survivor to report because quite often they are then being shamed by the whole family when the perpetrator is being arrested, for example, because the family says the breadwinner has been taken away and now the whole family is suffering. So, I mean, reporting is still important because otherwise it will never change, and we must try and put the blame on the perpetrator instead of the survivor, because survivors are their own best experts. And what we can do is we can provide them with resources and support, and we need to try and use a survivor-centered approach instead of telling the survivor, you need to do this and you need to do that, because it might not be the best solution for the survivor. We also must try and have a holistic approach in the topic, because we could provide, for example, mental health support for the whole family, not just the survivor. And we must look into economic empowerment programs so that the survivor and the family are not dependent on the perpetrator, which then leads to the not reporting the cases.
And that's also like brings us, I think, the interventions that you had mentioned before of the soup kitchen is very important, just so that people can sort of escape the abusive situation. They don't need to, remain there for their own safety. I think other interventions like that are important so that, they can actually get the help that they need without, like you said, relying on their abuser financially.
That's also one of the reasons why we named the soup kitchen Kagogo, a place of safety. So for now it's the building and the soup kitchen, but we are hoping to implement more projects within that space.
How does one practically get help? If you've been sexually assaulted, you've been physically assaulted, what are the steps that you have to go through or that one can go through to get help?
Okay, the best thing is to reach out. For example, SWAGA has a toll-free hotline, the 951, to report cases. The police has the number 999. Then there are also one-stop centers in Baban, Manzini, and Stegi, where survivors can go, where they will also get medical attention, legal attention to open the case. Counseling is important to overcome the trauma as well they've experienced. And then in severe cases, if you have reached out to an organization, a social worker, there can be a plan can be made to relocate the survivor into a safe house. There are a few in the countries. Fortunately, they are full most of the time, but it's worth a try.
Speaking of those resources that you mentioned, do you have any other helpful resources that people can reach out to, ways that people can reach out to the Phumelela Project?
Yes, so we have a landline number, the 2505-2407, and then also a cell phone number 78540144. You will also find us on social media, Twitter, Instagram, and Facebook, if you'd like to send a private message there. Okay, so we also have we created with Antidote Cultural Foundation and Yebo Art Gallery a booklet called Lighten Your Burden. It's a mental health toolkit. It is for free. So you can find the hard copies in our office in Manzini at Manzini Heights, office number 1, or at Yini Logo in Baban. And then you will also find a soft copy on our website or on our social media pages to download, and they're for free.
So, Kat, is there anything else that you maybe want to highlight regarding gender-based violence in Eswatini, what you've maybe noticed?
Yes, maybe to mention that we must also address the issue of mental health and drug and substance abuse, because those two topics, they are connected to GBV. There is a study from South Africa, and it shows that the high numbers in drug and substance abuse, they also rise the numbers of gender-based violence cases, because a lot of people, when they consume alcohol or other drugs, they start to get more aggressive, for example. And then this has an effect on how they react to their partners. And then also what we've seen lately in Eswatini is a rise in femicides together with the suicide of the perpetrator.
Would you also say it's alongside with the substance abuse? Would you also say it's the economic factors as well that also tie into this?
Most definitely, because if we look at since COVID, the unemployment rate has risen even more, and the poverty as well. So alcohol and other drugs, they seem to be an escape for some people in that moment. But long term, it is not an escape. It just worsens the situation.
It's a temporary band-aid.
Yes.
Thank you so much again, Kat, for joining us, and thank you for the insights that you've provided on gender-based violence in Eswatini.
Thank you so much for having me.
And thank you for listening. Please be sure to join us again for our next episode of the Rise and Thrive podcast. And be sure to follow the EU delegation at EU in Eswatini on Instagram, Twitter, and Facebook to stay updated on when episodes are released. Phumelela